Well, Redskins fans anxiously waiting to hear news of star quarterback Robert Griffin III's knee injury this noon.
Yeah, the breakout rookie is in
really
Florida
nervous.
today.
I'm wondering, going into this offseason, what we're going to be doing.
Sources tell ABC 7 News there is a tear in Griffin's lateral ligament and the ACL. Team owner Dan Snyder is with
He comes down on the left leg. Keep an eye on the left leg. There. Yep. When he planted.
It was later announced prior to the game that he has a torn ACL, something Bulls fans know all about.
The ACL, also known as the anterior cruciate ligament, is located in the knee and it passes from the lateral part of the end of the femur through the center of the knee to the anterior region of the tibia. It is one of the 4 major ligaments located in the front portion of the knee that connects one bone to the other. It is one of the most commonly injured ligaments in the knee. Approximately 150,000 ACL injuries occur each year in the United States. Of those 150,000 injuries, most are common in women. The role of the ACL is to limit hyperextension of the knee, prevent the anterior sliding of the tibia on the femur, and limit rotational movement of the knee. So naturally, when someone tears his or her ACL, it is due to either hyperextending the knee or over-rotating it. Some examples are the foot remaining planted while the knee turns, landing improperly during a jump, or experience of blunt trauma. Symptoms include pain, swelling, discoloration, may notice a snap or pop at the time of injury, joint laxity, and instability, which is the failing of the knee giving away.
Ligament injuries are usually graded in terms of their severity. An ACL injury is classified as a grade 1, 2, or 3 sprain. In a grade 1 sprain, the fibers of the ligaments are stretched, but there is no tear. There is a little tenderness and swelling. The knee does not feel unstable or give out during activity. For a grade 2 sprain, the fibers of the ligament are partially torn. There is a little tenderness and moderate swelling. The joint may feel unstable or give out during activity. Lastly, in a grade 3 sprain, the fibers of the ligament are completely torn. The ligament itself has torn completely into 2 parts. There is tenderness but not a lot of pain, especially when compared to the seriousness of the injury. There may be a little swelling or a lot of swelling. The ligament cannot control knee movements, the knee feels unstable, or gives out at certain times. To assess damage of the ACL, the person can lie in a supine position as shown, and the knee is placed in a slight flexion position. The femur is then stabilized with one hand while the leg is pulled forward with the other. If the leg moves without reaching a firm endpoint, the ACL is likely torn. An MRI may be ordered to evaluate the ligaments which do not appear on an X-ray. Once injured, seek medical attention immediately, especially if foot turns cold and blue. Do not attempt to move the knee and use a splint to provide additional stability. The physician will determine appropriate and specific ACL treatment options based on age, overall health and fitness, and medical history. There are 2 options: non-surgical treatment and surgical treatment. A non-surgical approach is appropriate if the knee is stable during daily activities and the knee cartilage is undamaged. In addition, the injured is willing to cease participation in activities that require pivoting movements such as sudden slowing down or jumping. Typical non-surgical treatments include wearing a knee brace, using crutches, and physical therapy. A surgical reconstruction is recommended if the knee continues to give way and if the person wants to return to significant sports activity. Surgical treatment is typically done arthroscopically, and surgeon will rebuild the ACL by replacing it with another tendon from the body of the injured or from a cadaver.
Depending on the severity of the tear, it would take about 4 to 8 weeks of gradual rehabilitation to heal the ACL. Following surgery, it would take at least 6 months of rehabilitation and may take up to almost 12 months. Specifically speaking, athletes can reduce their risk of ACL injuries by performing training drills that require balance, power, and agility. Additionally, adding polymetric exercises and balance drills help improve neuromuscular conditioning and muscular reactions. Many team physicians now routinely recommend an ACL conditioning program, especially for their female players.